Hey everyone, it's Aubrey with Northbound Physical Therapy and Wellness, and I'm here with a few tips for you if you experience mid back pain at work. Thinking about those who work on a computer, especially as we're maybe sitting in a posture for a while. My first tips for you are look at your setup, look at the height of your screen, the height of your hands when you're working. What is your posture adapting to get the work done? Make sure that you're sitting up with good upright posture and that your neck and shoulders can be relaxed while you work and your forearms can be supported. But when it comes to a movement element, make sure that you are getting up and doing some movements throughout the day. And right now, we're going to go through a few movements that can help with that mid back pain. So, mid back pain is usually related to the area where the ribs are meeting the spine. And that area of our spine can be relatively stiff. So, we're going to do a few movements that can help keep it moving. And the first one is some rotation. So, what I want you to do, I'm going to back up a little bit, is I want you to stand with one foot in front of the other. And we're just going to do some turns toward your front standing leg. Just going to come forward and back. And as you're twisting, you can take some deep breaths. You'll feel your ribs expand and relax. And on that exhale, you can see if you can twist a little further. And you can really do this at a pace that feels good to you, whether you're kind of planted and just kind of moving with it and swinging your body. You can even add some arm swings in. Or if it feels good to just do some holds, some breaths, and a focus on, when you're in this position, relaxing your jaw, relaxing your neck, relaxing your lower back muscles. It's also a little bit of a balance work. So you can definitely make your stance wide in this position. I'm going to take it the other way because now I feel like I need some balance here. It went to the left side. Now let's go to the right side. This should feel really good, should feel really nice to kind of get some movement through those parts of your spine that maybe don't get a lot of movement. If this causes you more discomfort, just go slow or listen to your body if it's saying not right now. Always honor your body. Okay, the second one is a movement that helps you open up through your chest and your shoulders, because again, our tendency is to we're working in a rounded position, or we're texting, or we're writing, and we're doing a lot of things in front. So let's take a moment to open up our chest. So for that, you can be standing in this posture in what a friend of mine refers to as the LeBron pose. So you're open through your chest, your palms are up or forward. You can't see my palms right now, but you are opening up. Again, always adding breathing into our stretches, our mobility work helps enhance it all. You could imagine I'm in a doorway right now. You can put yourself in a doorway and you can kind of open and gently lean forward into that stretch. The goal is to feel an opening across your chest and then through your spine, only going as intense as feels comfortable to you, and using that breath, low to medium intensity. I want to show you one final strategy for opening up your back and reducing that mid-back discomfort. And for that, we're going to take it to the floor. So I'm a PT, so I have, of course, all the toys of the trade. And if you don't have a foam roller like I do, you can use a completely flat surface, or you can roll up a towel. And what you'll do, I'll show you lengthwise, and you might lose me in the frame here a little bit, but that's okay, is if you have a foam roller, if you have a short foam roller that's a full circle like this, don't do this one on just a short segment, because then your head and your tailbone are going to be off, and that's going to be a little too awkward. So you want to have a longer foam roller. You're going to lay yourself on it from head to tail. My knees are bent and my feet are on the floor. And now this foam roller is kind of splaying my rib cage open over it. And I've given my put my arms out to the side, and now I'm getting a nice stretch across the front of my chest. So essentially, this position looks just like what we did in standing with that LeBron move. You also want to make sure that your lower back, if you're on a foam roller like this, the tendency can be for if your mid back is stiff, your low back's really going to arch. So just gently flatten out your lower back and put it in contact with the foam roller. Open up your chest, and then again, some deep breaths. As you breathe in and out, you can feel that expansion of your rib cage. It's going to expand side to side, front to back. You'll feel it in your chest. And then again, with those exhales, just allowing your body, giving it permission or letting it know it's okay to just relax and let these tissues open up. Now, for some people, even being here might be a big stretch, so you can move your hands down or to this T position. If you want a really big stretch or you just want a new position, you can bring your arms up overhead or to, we call it cactus arms, right? Where your elbows are bent around 90 degrees. And you're just allowing gravity to help open you up. Breathing into those tight spots and hanging out here for as long as it feels good for you. A couple of minutes, maybe. The way to know is, how do you feel afterward? Afterward, you should feel a more positive sense of comfort in your body. Maybe you feel more awake, you feel more alive, you feel blood flowing. The foam roller, again, can be very aggressive to people who have a stiff spine. So if your spine is stiff, if you know that you're not super flexible through your upper body, try it flat on the floor first, and then maybe progress to a rolled up towel. There are certainly many more things that you could look at and do for mid-back pain, but these are a couple of favorites from my practice. If you have persistent pain that's going on for more than 4 weeks or so, seek the help of a medical professional, a physical therapist, or your primary care physician, so that you can make sure that pain doesn't interrupt your life. Well, thanks for following along with me today. I hope this was helpful, and I look forward to seeing you next time. Thanks.